So what medications, if you are on, what medications can actually affect your bones? We know that steroids is one of them. Are there any other medications, and what does steroids do?
Yeah, well, steroids, I mean, without going the, pharmacodynamics and all that too much, inherently long-term have a whole scope of effects on the body as they relate to the adrenal glands. There are certain glands in our body, endocrine glands, which are essential to life. If I have a person who is on steroids for, let's just say, some other reason for their whole life, they just take it for granted, even just dropping them from 5 milligrams a day to 0 could be potentially fatal, because they could be thrown into an adrenal crisis, and that could be it. This is an example from a hospital-based experience and training in life. To your point, though, yes, there are a long list of medications that can affect bone health, and most of these are correlated to how it affects bone physiology. And I would maybe tie in the dietary component to this at this point. Why does, for example, drinking soda beverages make bones weaker? Well, because what it does is makes the blood relatively more acidic. In other words, the more sugar content one has, the more acidic the pH of the system becomes. What does that then do? In order to buffer that, the blood actually leaches calcium off the bones to buffer that acid. There are a myriad of different things you can look on Google Images if you want to look at, like, foods which alkaline your body, foods which acidify your body. I think it's worth looking at. I'd probably like to lend people there, because they may not realize. And a good example, people think, well, calcium, hey, listen, we can get some milk.
Yeah.
Milk actually makes your body a little bit more acidic. Not dramatically so, but if one was thinking they were doing themselves very much good for their bone health by drinking a lot of milk, they were under a misapprehension. That is not good. The best way to get calcium to deposit on your bones, or at least prevent it from being leached off your bones, is to be in a more alkalotic environment, which prohibits this buffering by the hemopoietic system or the blood system. We have several ways to buffer acid: the blood, the kidneys, and breathing. These are ways we can make our body more acidic, more alkalotic. So I encourage people to look first at the dietary element of this. And then, of course, it's not hard to look up online. There's a series of medications which, because of how they work, can affect one's bone health.
Yeah. And we have a lot of people that are on prednisone that are worried about AVN, and that would like to know, when would you recommend going to see a doctor?
Well, I think any doctor who's going to put a patient on steroids is probably going to have to start by saying, and this is what I do, and this is just, my practice is different. I don't focus on lupus explicitly, but and I have some lupus patients in my practice, not a whole lot, but some, okay, if a person's asymptomatic, largely, with some exceptions, there isn't much to do. If a person isn't complaining of anything or whatnot. But let me give some examples of exceptions to that rule. Let's say a woman is pregnant and goes for a routine checkup and does a urine test and is found to have a urinary tract infection. Even if she had not complained of any burning on urination or anything, she's automatically treated, because the threat of that becoming an ascending kidney problem or pyelonephritis, it could threaten the entire pregnancy. Similar thing for diabetes. If a person has urinary tract infection, they're just treated because they can't feel it. In the context of lupus, I think there is a whole host of monitorings that need to happen to make a parallel against diabetes. So what do we do for diabetics? So if a person's diabetic, we send them to the ophthalmologist once a year to check for diabetic retinopathy. We make sure that they get kidney checked. Make sure we send them to a foot doctor to ensure they don't have any wounds, again, because they can't feel necessarily, and a wound in the foot can get out of control, and that could be the end of the game. So in the context of a lupus patient being treated by a lupus expert, when they get put on these medications, certainly any symptom would prompt further investigation. But because of how tenuous this condition is and how it can go in many different directions, I need not educate the public, everyone who's listening to this. Some people have milder courses, some people have ones which really are pretty severe. The way I would liken this is to say that I think that there's a certain amount of screening which needs to happen. And this goes into one of your questions about bone density, is to say, all right, well, let's just say patient A is going to be on steroids for the foreseeable future, or for the time being, let's say indefinitely, 5 to 10 years, whatever it may be, who knows. I think it's inherent in that kind of patient that there would have to be some sort of screening for bone health as it relates to certain labs, as it relates to imaging. And that encompasses these things, which I guess we can segue into as far as testing is concerned. I think DEXA scanning is probably the best one. I understand as it relates to giving you a score, and there's different scores based upon which then interventions such as vitamin D, Fosamax, or alendronate, which is a pharmacological name again, can be used to rebut if there's going to be problems. That's how I think of it.
Got it. And let's say